My name is Linda Kay. I'm 65 and I live in Monmouth County. In May of 2005, I began to have shock-like pains in the right side of my face. I didn't know what they were. I went to a dentist and had quite a bit of work done, but that didn't stop them. In fact, they got worse. They went from shock-like pains to boring pains to burning sensations all along the right side of my face. The episodes got longer and more intense, and the time between them got shorter. I tried medication, which for me did not work. I had wonderful treatment from a chiropractor, Dr. Pamela Levy in Englishtown, and from an acupuncturist, Christine Talercio at Acupuncture Works, and they kept me functional for 5 years. But in the fall of 2009, I decided that I needed to do something further. I saw that they were using CyberKnife treatment for trigeminal neuralgia in the Meridian magazine, The Health Views, and it was with Dr. Rosenblum, who had treated my husband, and I knew and trusted him. So I went and was interviewed, and he thought I was a reasonable candidate for the procedure. I then was referred to Dr. Danish, and he also thought I was a good candidate for CyberKnife. I did the pre-testing about 2 weeks before the procedure, and in February of 2010, Drs. Danish and Rosenblum just changed my life. The procedure was a one-time deal for me. It took about 90 minutes, and I can tell you I fell asleep while it was going on. I got up and went out to lunch, and my life has been different ever since. The pain stopped within 2 weeks of the procedure, and I did not have any again until about 6 months later. I had been warned that it might get worse before it got better, and that the 6-month time frame is sometimes when the full effect of radiation can be felt. So I was a little concerned and was in the process of finding out, could it be redone, and the pain stopped, and that was the last pain I have had. The procedure was about 18 months ago, and I have to tell you, if I had the choice, I'd do it all over again tomorrow. So if you're in pain and you're thinking about this, don't wait, because it's not worth the time if you don't, if you're not comfortable.